Are you thinking about taking weight loss medication as an injection, but you're a little bit nervous about the injections? Well, I've got to admit, I was exactly the same. I was worried, okay, what's the size of the needle? How difficult is this? Could I really inject myself? And so I wanted to put together a video of myself injecting as I do every week or every fortnight, as it may be at the moment, and just to hopefully alleviate some of those concerns for you, because it really isn't a big deal like we think it is in our head. So hopefully this video will help you and you can follow through step by step. I'm Alison, and I share my personal weight loss struggles and wins, as well as encouraging other people in their own weight loss and mindset, and hopefully working towards a happier and healthier life. This video is my personal injection process. I'm not a doctor, I'm not a health professional, so please always take the advice of your doctor or health professional in regards to injecting medication. This video is just for informational and entertainment purposes only. I really do remember how worried I was about injecting for the first time, and even thinking about going on to weight loss medication. One of the reasons I was a little bit hesitant was thinking about having to inject myself, and would I be able to do that? Once you actually see the size of the needle and you watch someone do the actual injection process, it is a lot less overwhelming, and hopefully this video can give you some confidence in that. I think the biggest thing that you need to really think about is to have a nice, calm, quiet space where possible. I know that's not always possible, but if you can, and it doesn't have to be in some, clinical, perfectly, what we say, hygienic space, but you do want it to be a clean space, whether that be your kitchen bench or it could be in the bathroom on the vanity. You just want a space where you can pop out all of your items so that the process runs smoothly for you, especially in the beginning when you're learning and you're a little bit nervous. The most important step happens at least 30 minutes before you are going to inject your medication, and that is to take your medication pen out of the fridge. The reason being is that your medication is stored in the fridge to protect the medication. However, if you inject the medication when it is at the temperature that it is kept at in the fridge, it can be a little bit stingy and it can hurt a little bit more. So the best thing to do is at least 30 minutes before you are going to inject, just take that out of the fridge and pop it onto your bench. Then you're allowing your medication to come to room temperature. Just remember to leave the lid on it until you're ready to go into the next stages. Meanwhile, you can get the rest of your items ready, even though it's not a lot, and make it sound like it's a big preparation, but it's not. So other than your pen, which is already out going to room temperature on the bench, you will also need your needles that will go on the top of your pen. You'll need an alcohol swab, and you'll need a sharps disposal bin as well. After 30 minutes, thoroughly wash your hands with soap, and then you will want to check the date on your pen and make sure that it is in date. You'll also just want to have a look in the window of the pen and make sure that the liquid is clear and that there isn't any floaties or things inside that liquid. The next step you'll want to take is to choose where you would like your injection site to be. Wegovy and many other GLP-1 medication injections are subcutaneous injections, and all that means is that they are injected into the fatty tissue, which is the layer just under the skin. So you generally have three main sites that you can choose from. You can choose the belly, you can choose the thighs, on the top of the thighs, or you can choose the back of the arm. The stomach and thighs are a really great option because they're super easy to reach. If you do want to choose the back of your arms, you may need some assistance from someone else just to be able to reach and hold while still doing the injection. Make sure to rotate your injection site each week. This is to help avoid irritation and bruising. Once you have chosen your injection site, take a seat so that you can try and relax throughout this process, but have all of your items really close by where you can reach them by hand. My pens are not single use, and so it's not until right before I'm about to inject that I will pop on the needle on the top, and then I will remove the 2 caps that are on the top of the needle right before I'm about to inject to make sure that I avoid any needle stick injuries. Using the alcohol swab, wipe the area that is going to be injected and allow it to air dry. Remove the 2 caps covering the needle. Dial the pen one small click where you can see the 2 dots and a line. At this point, you should see a drop of liquid on the end of the needle. If you don't yet see a drop of liquid at the end of the needle, you can click the button at the end and then you should be able to visually see that drop of liquid, which indicates that your needle is working and you're ready to move forward. Now dial the pen as far as it will go, and it takes a while. Just keep turning. My pen on this video is 1 milligram and has 4 1 milligram injections. By dialing all the way, this will inject 1 milligram dose. Once dialed and ready, I hold my fatty tissue ready to be injected, but just before I put the needle in, I take a deep breath and relax. This tends to help me. Now place the needle onto the site at a 90-degree angle. Hold and click down the button on the top. You may sometimes feel a little sting sensation, but it's usually over very quickly. Hold down the button until you hear a click and all of the volume of medication has been injected. It's also a good idea to now count to 10 slowly before removing the pen from your body. Now replace the caps onto the needle to avoid needle stick injury. Check your injection site. Usually there is nothing to see, sometimes just a small spot of blood. Now screw off the needle on the top and place into the sharps disposal container. This is usually provided, but if not, visit your chemist or pharmacy and ask where you can get one. Place the large cap back on your pen and put it back in the fridge ready for your next week. And you're done. I hope that this video helped you find your confidence and you're able to confidently inject your medication. I have popped 2 videos up here that I think you may be interested in, so check them out and hit the subscribe button if you'd like to follow along on more of my videos. Take care, and I look forward to seeing you again soon.